for all your support. So, is he holding? Yes. Right, so I'm going to spend the next 15 minutes or so telling you about the history of the hospital, what we're currently doing, and what we hope to do in the next 2 or 3 years. So this is the picture you normally see of the hospital in Lahore, which opened in 1994. This is our 24th year of operations. This is the other hospital in Peshawar, which opened at the end of 2015. The second hospital of the trust. Each year in Pakistan there are approximately 150,000 new cancers. And unfortunately, because of the advanced stage at which these patients present, between 60 and 80,000 of those patients die within the year of diagnosis. This is the mission statement of the hospital. I don't expect you to read it all, but the salient features, the core elements of the mission statement are highlighted in red. Excuse me. So first of all, we aim to act as a model institution. As we said, there are over 150,000 new cancers each year. One hospital cannot possibly treat them all. But the hospital aims to overcome the sort of nihilism that we often experience in Pakistan, that we're afflicted with in Pakistan, that nothing can be done to excellence. We aim to show that it is possible to achieve excellence in Pakistan, and that there's no particular reason why that can't happen. We are primarily a cancer hospital, obviously, and the core element on which we base our acceptance and treatment is that once a patient is accepted into the system for treatment, all treatment is provided irrespective of the patient's ability to pay. So patients are means tested once they're accepted, and if they're judged suitable for support, then all treatment thereafter will be completely free. And that's where we rely on the support from friends such as yourselves. We also have a role in education of both healthcare professionals and the public. We run training programs for physicians, nurses, medical technologists, and allied health professionals. And we run some very visible and very important annual public education campaigns into early diagnosis of cancer and prevention of cancer. And lastly, we are a research center. We perform both clinical research and basic science research into the causes of cancer and aim to try and find new treatments for cancer. So our core values are quality and equality. Quality we'll talk about more in a second. Equality in everything we do, that is our paramount aim. We aim to ensure that all access is equal for those who are paying or for those for whom someone else has paid. Indeed, we look on all our patients as paying in the sense that there's a minority that are paying for themselves and everyone else has been paid for by someone else, but the hospital has received payment nonetheless. And this relates to whether it's the doctors that are seeing them, the treatments they're provided, the facilities they get within the hospital, so the rooms they are admitted to and so forth. There is no discrimination between those who are paying and those who are not. And as physicians and nurses, we're blinded to the patient's financial status, so we actually don't know who's paying and who isn't. All our rooms are dual occupancy, such as the ones you see in the picture, and it's not uncommon to see a patient who's paying for themselves and a patient for whom someone else has paid in the same room together. Consistently over the last 24 years, we've maintained this percentage, this split of 75% of our patients receive financial support from the hospital, and about a quarter pay for their own treatments. And in this time, in the last 24 years, over $370 million have been spent in providing philanthropic treatment for poor cancer patients since we opened. And this, for the last 3 years, this includes patients treated in Peshawar. So our current projects include the hospital in Lahore and the hospital in Peshawar, which we've discussed. We're commencing construction for the third hospital in Karachi on the 1st of December, inshallah, so we look forward to your support for that as well. We have diagnostic centers in Karachi and Lahore, and we have walk-in clinics, which are the clinics where patients can come with a diagnosis or a suspicion of cancer to be assessed and worked up to see if they can be accepted for treatment. These clinics are functional in Lahore, Peshawar, Karachi and Multan. In addition, we have a nationwide network of nearly 200 collection centers all across the country, where patients can come and pay to have lab tests done, and all proceeds are plowed back into the system to help treat more cancer patients. So just looking at the last completed year of operations, which was 2017, I've talked about some of the stuff across the top of that slide. There's an almost 50-50 split in the budget, or at least there was in 2017, between zakat and donations, which make up just over 50% of the total budget, and clinical services, which is primarily the pathology network that I spoke about, but also the proportion of our patients who pay for their care. That contributes the other half of the budget. For 2018, our budget was 11 billion rupees, which is just over $105 million, I think. So some of the important numbers for this past year: we had registered 9,000 new cancer patients in 2017, treated over 65,000 radiation treatments were delivered, close to 15,000 surgical procedures were performed, nearly 50,000 chemotherapy sessions, 12,000 admissions, and nearly 250,000 outpatient visits. The number of lab tests you'll see is obviously huge. That's not all the patients from the hospital alone, but that includes the collection center patients. Perhaps our proudest achievement for the past year has been the acquisition of Joint Commission accreditation. I know there are a lot of physicians here, but for those of you who are not physicians, all hospitals in America are accredited by the JCAHO, the Joint Commission for Accreditation of Healthcare Organizations, the international arm of which is called Joint Commission International. This measures overseas hospitals against the same stringent standards applied to American hospitals. And we became the third hospital in Pakistan and the first charity hospital to acquire this accreditation following a very long, exhaustive, week-long audit by US auditors in April this year. Some of the other highlights of the past year have been extensions to current facilities in both Lahore and Peshawar. In Lahore, we extended the endoscopy suite. We extended our emergency and assessment room. This was actually a Joint Commission requirement that children be treated separately from adults, so we opened a separate emergency room for children and converted the existing one into an adult emergency room. We have a long-term commitment to installation of state-of-the-art equipment. We recruit our consultants, our physicians, from overseas, primarily from the US and the UK. These are highly trained people, and we need to provide them with the tools necessary to practice their skills to the highest possible degree. And this is one of the things that we do. We have the largest radiation treatment facility in Pakistan, and this was one of our new linacs that we installed earlier this year. The pediatric bay, pediatric ward where patients are admitted, is also already child-friendly. And we converted the pediatric chemotherapy bay, where children come in for a few hours each day to have chemotherapy, to make that more child-friendly as well. This was done with the assistance of students from the National College of Arts in Lahore. So the Lahore facility is really maxed out. Everything, we really can't accept any more patients or institute any new treatments or develop any new clinical services because the existing building is completely occupied fully, with operating theatres running till 11 and 12 p.m. at night and so on. So we plan a new clinical tower which will effectively double the clinical capacity of the Lahore hospital. And this is the architect's plans. We hope that we will be able to start construction on this in the middle of next year. Traditionally, we had a great deal of trouble with the Lahore Development Authority in getting any kind of approvals. And we hope that that may be easier now. While adhering strictly to all rules and regulations, which we always do. So the new clinical tower will have facilities for expansion of the inpatient facility, a new emergency and assessment room, expansion of the pathology laboratory, nuclear medicine and radiology will expand into this building, a new bone marrow transplant unit and a day surgery unit. So this will significantly decompress the existing building and will also allow renovation of the existing building, which is now nearly 25 years old. So the hospital in Peshawar, I already showed you a small picture. The physical structure of the Peshawar building hospital was completed altogether. But clinical functions were designed to open in 3 phases. So when we opened at the end of December 2015, that was with our diagnostic facilities and with chemotherapy or medical oncology facilities. So patients wouldn't have to come to Lahore from KP in Afghanistan to have chemotherapy, which is obviously repetitive and cyclical and quite difficult to do. Phase 2, which is just completing now, was the installation of radiation equipment. And you'll see as you look at it, the large crater on the left of the building was the excavated site for the radiation bunkers, which is now complete. It's covered up and has grass over it now. So we have 5 radiation bunkers there, just as many as we have in Lahore. In every way, the Peshawar hospital is designed to be bigger and better than the facility in Lahore. And inshallah, Karachi will be better than both of these, as we learn from our previous mistakes and experience and so on. So phase 2 is essentially complete, and radiation will commence in Peshawar in January 2019, inshallah. And then phase 3, which is the initiation of surgical services, will be the middle of 2020. So all activity in Peshawar has increased very much in line with our expectations, whether you look at those same parameters we looked at for Lahore: outpatient visits, chemotherapy, admissions, pathology tests, and so on. As a result, we've already had to expand the chemotherapy bay. We have a number of beds. We didn't open them all initially, so we're opening more and more of those now in the chemotherapy bay. And we were very fortunate to also recruit a pediatric oncologist for Peshawar earlier this year. So we are now able to treat children with cancer from that region also closer to their homes. We've also increased our inpatient bed facility in Peshawar. And we've expanded the pathology lab, because what we've now done is all the collection centers from the KPK now feed into the lab in Peshawar rather than having their samples sent to Lahore, which improves turnaround times for results for those patients. I think you saw this in the video as well. We had the formal groundbreaking ceremony for the Karachi hospital about a year ago when we were awarded the land. And actual physical construction, as I said, will start on the 1st of December 2018, so less than a month away. This is the first time this is being shown. This is the architect's rendition of the 3rd Shaukat Khanum Cancer Hospital. Being culturally sensitive, it's not going to be red brick, it's going to be sandstone in keeping with the architecture of Karachi. It's designed by the same US firm of architects based in Louisville, Kentucky, who designed the hospital in Lahore as well as the hospital in Peshawar. So they have a great deal of experience working with us and in designing cancer hospitals, both in Pakistan and the US and elsewhere. Unlike the Peshawar hospital, the Karachi hospital will open all in one go, as it were, as Lahore did. So it'll be a complete facility from day one with surgery, radiation oncology, and medical and pediatric oncology all in one go. To support the Karachi hospital, we've also opened a number of new collection centers in Karachi. So this year our budget is $92 million. I think this is prior to the recent devaluation. I think it's, and that is required not only to continue our mission, but also to fund a number of these expansion projects. Where we expect this money to come from this year and the next is that zakat and donations are likely to make up a larger proportion of the pie, and hospital revenue will be about 40%. So it's important to stress at this point that revenue from the hospital's diagnostic services and our own any other income that we generate ourselves is utilized to cover the hospital's expenses. When you donate zakat, that's spent exclusively on patient care and only on direct patient care, so the supply of medicines and so forth. It doesn't pay for buildings or equipment or any kind of construction. It doesn't pay salaries, and it's not invested. All zakat collected is utilized within that calendar year. It's never carried forward. And just to stress this, some years ago there was rumors were spread, or in fact it was stated very clearly that we were not spending the zakat, or that it was being invested or used for other purposes. This is not true, and this graph shows that each year the amount of financial support we provide for direct patient care far exceeds the total amount of zakat collected that year. So if you look at 2016, we collected $22 million in zakat, but the total amount that we spent for financial support was $49 million. And that statistic you can look at for each of those years. So there's never any question of not spending all the zakat within the year that it's collected. So how can you support us? You've already heard some very stirring appeals for donations. Remember that no donation is too small. When the hospital opened in 1994, although I'm sure there were people who gave millions of rupees or even dollars at that time, the average size of donation was 10 rupees. And even today we stress that no donation is too small. Don't be shy or embarrassed about how much you give. It's, as you said, as Dr. Arai said, it comes from the heart, and we appreciate whatever you can give. So this is, each year we use actual patients, obviously with their permission and their family's permission. In our zakat campaigns, you saw one of the advertisements, this is the more recent one. So one of the ways that you can support this project is to become a founding donor. A donation of $5,000 can be, will get you or a loved one recognized in a founding donor monument at one of the new hospitals, so in the new clinical tower for Lahore, or for Peshawar, or for the hospital in Karachi. You can actually dedicate or donate a room or a bigger area, an operating room or the emergency assessment room and so forth. And the prices for these vary. They're on our website. We can share them with you later. You also have, I think, leaflets, brochures on your tables which will provide you with some of this information. Obviously this is more expensive and they start from around $50,000. You can pledge a monthly contribution like a standing order or a direct debit. And again, this can be just to Shaukat Khanum, or it can be to a particular hospital if you wish. So it can be to wherever you're from. If you want it for a particular hospital, that's entirely up to you. And again, the amount is completely variable. You can sponsor the purchase of equipment, and again, it varies from something as relatively inexpensive as a pulse oximeter for a few $100s up to a CT scanner or an MRI or a radiation machine. You can sponsor the treatment of a cancer patient, and these are this is the menu for some of the cancers that you can sponsor, and the prices that are shown there, ranging from about $5,500 for the treatment of lymphoma to $14,000 for some of the more difficult to treat leukemias which require bone marrow transplantation. You get a patient profile, and again, with the patient and their family's permission, you can actually get photographs and other information. We don't allow direct contact with the patient, however. You could donate meals for a day, for a month, for a year, for a ward, for one child, or for 10, and so on. And there are various price ranges for that. We are a registered charity in the US, as you know, and so you are eligible for tax exemption based on your donation to this charity. You can donate online and in various other more traditional ways. You can also donate in Pakistan if you wish to donate there. I think I'll stop there. I'm happy to take any questions if there are any, or comments, suggestions. Otherwise, thank you very much for your attention.